Welcome to tonight's Prevea orthopedic presentation, Why Do My Knees Make Noise, with Dr. Scott Haskins, orthopedic and sports medicine surgeon for Prevea Health. Let's welcome Dr. Scott Haskins as your presenter for this evening.
All right, thanks, Chris. We'll get started here. So, as you said, this presentation is called Why Do My Knees Make Noise? And I'm going to try to talk through some different reasons that knees and other joints make noise, how we can kind of figure out if it's an important noise that needs to be assessed or treated, or if we can just leave it alone. And then I can talk a little bit about the prevention of joint noise and maintenance of joint health. And then I'll talk about some different treatments as well. So we'll try to go through a lot of those things here in this short presentation. And again, send a question over to Chris if you have one. Here's just a little information on myself. Just a little background. I am located mainly in Sheboygan. I also have clinic in Manitowoc and Plymouth. I do cover a wide range of general orthopedics, including fractures, joint replacements, and all the basic orthopedic principles. My specialty is in sports medicine. So at the knee, that involves ACL repair, reconstruction, cartilage, surgery, meniscus repairs, and arthritis surgeries. And then also a focus on the shoulder, but really most joints in the body. I did my sports medicine fellowship at TRIA in the Twin Cities, and then kind of a tour of the Midwest for my other training residency in Kansas and college and medical school in Wisconsin. And I'm from the western part of the state. Although I am centered in Sheboygan and Manitowoc and Plymouth, we do have orthopedic providers all around the state, up and down the eastern side here, as seen on this map, and over in the western part as well. So if you do have questions that come out of this presentation or related to your orthopedic care, we have providers all over the state. So I talked about the overview already, so we'll go ahead and get started. First question, why are we talking about joints? And joints are where two or more bones meet to allow for movement and mobility, and they are all over the body. There's hundreds of them. Each one allows for varying degrees of motion. They can provide cushion and distribute force for motions. And their movement of the joints is basically essential to the everyday activities that we enjoy, including walking, running, standing, and most other activities. Really basic to all our things that we love to do and that we have to do. Quick picture on joint anatomy that might help understand the rest of the presentation. This is just a picture of a regular basic joint where two bones meet. At the end of each joint, that thin layer of cartilage that goes over the bone allows for those two bones to move smoothly against each other instead of having a grinding bone surface rubbing against each other. Each joint is also lined by what's called a synovial lining. The joint lining provides joint fluid, and this can get inflamed and painful. The ligaments around the knee provide stability. In some joints, there is a meniscus or a cartilage pad that provides extra cushion, padding, and stability. And then, importantly, there's synovial fluid in each of the joints. Each has a varying amount that is present, but this reduces friction. It helps cushion the joints, and it also contains gases. And we'll talk about how these different things can all make noise. So one of the most important things that we're going to talk about today is the difference between physiologic joint noise and pathologic joint noise. So physiologic is a characteristic of the body's normal functioning. It's not concerning or causing more damage. In general, it doesn't cause pain. Also, in general, there's no intervention necessarily needed for physiologic joint noise. On the other hand, pathologic is a little different. It's generally caused by a specific abnormality in the joint. It may indicate underlying injury or damage or inflammation, and pathologic may require intervention depending on what the cause is. So a couple different differences. For instance, the onset for physiologic joint noise, oftentimes people don't know when it started, or it may have been present forever. For instance, someone would come in and say, my joints have been popping forever. It doesn't hurt. I have no idea when it started. Pathologic, on the other hand, is generally very noticeable when it starts. It still can kind of come on slowly and chronically, but people generally could say or guesstimate a time when it started. It can be acute. So if you have an injury, that can be an acute specific onset of joint noise. There are also many different noises. I'll kind of talk through a few of them, although there's a fair amount of overlap in some of these, but I think I have 5 listed here. So for instance, a pop is a sudden sharp explosion. I think this is what people are describing when they're talking about cracking their joints as a physiologic cause. And a pathologic cause might be in the setting of injury. So people who feel their knee pop when they injure their ACL or meniscus. A clunk is more of a loud singular noise that's a release against resistance. Physiologic cause can be an inflamed plica band in a joint. We'll talk about those later. Pathologic could be fibrotic nodule or joint instability. Clicks are a common cause of joint noise, or a common thing that people ask about. It's usually a fainter singular noise, generally occurring with motion. It could be shifting gas or fluid or a mobile meniscus. A pathologic cause of a click could be a meniscus tear that's getting caught in the joint. Snaps are generally sharp sensations of one structure kind of snapping over another. Physiologic could be a hip flexor snapping syndrome. Pathologic may be a plica band causing cartilage wear. And then grinding or crepitus is kind of that continuous scratching or kind of like almost a rock running over a surface. Physiologic could be just muscle imbalance with motion. Oftentimes at the shoulder, you can get some kind of grinding in there. Pathologic may be arthritis or wear and tear of the cartilage or a cartilage injury. So just going through a few of the physiologic causes here. So one of the most common ones is cracking or popping the joints. And on the picture here is the fingers, but most of us can pop one joint or the other, whether it's your neck or your knee or basically any joint. It's a normal process. The mechanism isn't still 100% fully understood. Up until recently, it was thought that this was like the popping of gas bubbles. A interesting study came out just a couple of years ago where they actually used a dynamic MRI. So they did the process of joint popping, and they saw the joint capsule around the joint stretch, and gases such as oxygen, CO2, and nitrogen escape the joint fluid. And then something called tribonucleation occurs. So it's friction between fluid and surfaces, and that actually causes cavity formation. So the formation of the bubbles causes the noise. It's not the popping of bubbles, it's the formation of it. So that was a really interesting study that gave us a little more direct visualization of what's going on and a better understanding. But this is a physiologic issue. It doesn't need to be addressed, and in general does not cause pain, and sometimes actually causes some relief. Another very common physiologic cause is snapping ligaments. And this can occur anywhere. It's maybe a tight ligament that just passes over a small bony bump and snaps as it's going back and forth. At the hip, there's a couple different places. One is in the front where your hip flexor is. Often occurs when you're bending up the hip or doing ab exercises or things like that. You can have a popping at the front of the hip that's generally physiologic, and as you get a little bit better flexibility and motion, that can go away. On the outside of the knee, on the lateral side, kind of where you can feel that bone coming out on the outside of the hip, the IT band can snap over there. So the IT band is where the gluteal muscles and hip muscles come together and attach, and it actually, as you can see in the picture, goes all the way down to the knee. So it can snap over that side of the hip, but it can also snap at the knee. So this is a common one that people come in with, asking about the noise. If it's not painful, it's physiologic, we can work on stretching. A word I've used before in the presentation is called synovial plica. So it's a normal remnant from embryologic development, and it's just a fold of normal tissue in the joint. It can be larger or more prominent in some people. In general, it's supposed to go completely away, but it can persist. Sometimes in some joints, even as much as 50% of people have a persistent plica. Generally causes simple painless click. You may notice it in the elbow or the knee. If this becomes inflamed or actually starts rubbing and wearing down the cartilage, then we could consider it pathologic, as we'll talk about in a minute. One directly at the knee is talking about the meniscus, that C-shaped pad. And it provides cushion and stability in the knee, as we discussed before. Normally has some motion to adjust during weight bearing and walking, but it can move more than normal and cause a click. The discoid meniscus, as pictured here, is the one that's just a full circle instead of the C shape. And that's a larger than normal meniscus, usually on the outside, the lateral part of the knee. It can cause clicking or catching. If it's too big and causing a problem, it generally presents somewhere in adolescence, and it can be pathologic if it's too large or actually locking up the knee. But in general, this is just a physiologic noise. And then the last one listed here is post-surgical noise. So pretty much any surgery on a joint will cause some noise, and it's a very common concern after surgery that you have some noise remaining. It's a normal aspect of the healing, and generally it's not a cause of pain. It can be healing tissue. It can be change in pressure, especially for arthroscopic surgery, where you have some air that gets in the joint and you have release or change in pressure. And then after joint replacements, the metal and plastic can click, which can cause noise that generally people get used to. Promotion of motion, rehabilitation, time generally improves these symptoms. And then we'll talk here about some pathologic causes. So one of the most common and one that people are concerned about is degenerative joint disease. So each bone is covered with smooth articular cartilage at the joint. And it kind of almost looks like porcelain, as you can see in that picture there. Over time, cracks can occur and can even develop into loose cartilage flaps. Sometimes these are able to heal themselves if they're small enough and you have good enough blood supply, but if not, they gradually can worsen and you can have formation of bone spurs. You can get larger, instead of small cracks, you get canyons or potholes in the knee. And then it can also affect the other structures in the joint. So it could be associated with meniscus tears. And then the noise is generally associated when that can catch and instead of moving nice and smooth as a joint, it causes mechanical symptoms. And this can worsen as the cartilage wear goes on. So this picture here is a picture of arthroscopic surgery. So taking a look in the knee, the smooth cartilage around the hole is healthy, but there's a tear and a hole in that cartilage. So when the knee is trying to move smoothly, it's actually catching, and that can cause grinding or clicking. When associated with pain, that's considered pathologic. Another cause can be a meniscus tear. We've talked about the meniscus, but this is a picture of when that tear actually displaces and comes out into the joint. So when you're trying to walk on it, it can catch or snap over that bone, can even lock up the knee, especially associated with when you're twisting, pivoting, changing direction, you can have that sharp noise. Loose cartilage can also occur in any joint. So if you have an injury where you land on the joint or it gets twisted with a ligamentous injury, that can cause some unstable cartilage. You can also have a failure to heal during development. So during development, that cartilage needs to heal into the bone. Sometimes a portion of it may not completely heal. And during adolescence or in the teenage years, it can actually come loose. That can go into the joint and cause catching or crepitus. And then loss of blood supply can occur. We call that avascular necrosis. There's kind of a picture of that loss of blood supply under the cartilage there with that loose cartilage piece coming out. We talked about how the synovial plica can be physiologic, but it can also become pathologic when it gets too big or when it gets inflamed and starts rubbing over the joint surface. This can especially happen at the knee, where people feel kind of a catch, especially with straightening out the knee, and that just never goes away and can cause achiness in the knee. It causes louder snapping or grinding. And then another common cause of joint noise can be instability, and there's varying degrees of the injuries. And as you can see in these pictures, it can happen in most joints. So acutely, it could be an injury to a ligament that causes the joint to displace or sublux out of place. Chronically, it can be caused by laxity, loose ligaments, we call that hypermobility. Injuries can cause clicks. The reduction can cause a clunk. So shoulder instability is a common problem. And it's not that it's coming all the way out of joint all the time, but some people have it slide out of place. And then when you move your shoulder back into place, it can cause a clunk. Patella instability, so kneecap as pictured on the top there. With motion, the kneecap can come out of place and then clunk back into place. You can have this at the hip. So hip dysplasia is when the ball and socket doesn't fully form and that hip can kind of slide up and down. You can get a kind of clunking as that comes back in. It can happen at the elbow, shoulder, really all over the body. And then we talked about physiologic post-operative pain. There can also be pathologic, so troublesome post-operative pain. This could be caused by hardware that comes out of place, or we use bone anchors in the joint that can actually detach. If those come out of place, that could cause grinding in the joint or a snap if it's moving in and out. You can have scar tissue that forms too much. It's also called arthrofibrosis, where it gets really scarred in a joint and you have a hard time moving. And there's generally tightness after every surgery, but excessive inflammation and scar formation can cause painful, noisy joint motion. And then you can have a patella clunk after knee replacement, which might be caused by some scar tissue there or instability of the kneecap. So this is generally associated with pain and stiffness. You would want to review this with your surgeon at postoperative appointments if you have these questions, and then checking if noise, pain, stiffness occur that just is not getting better. So a little bit on prevention here. This first slide is just talking about generalized bone and joint health. So starting with a balanced diet, really to maintain that healthy articular cartilage. Keeping at a normal weight is important because over 6 times the body weight can go through the weight-bearing joints. For instance, when you're going upstairs or downstairs, 6 times the body weight can go through that knee. So even if you lose 5 pounds, that can be 30 pounds of pressure off that joint. So especially if you are having some early arthritis, that can be a big difference. As far as supplements go, there's no specific proven pill that can maintain joint health. Glucosamine chondroitin is one that's commonly used and commonly sold. It does contain the structural components of cartilage, so theoretically that would provide those nutrients to the joint to keep them strong and healthy. Studies have had conflicting results on how beneficial this is, but they are safe as long as you're getting them from a safe source. So although I don't specifically recommend that to patients, it is something that can be tried. Specific vitamins, vitamin D and calcium are really good for bone health. Keeping the bone underlying that cartilage strong and healthy can give a lot of support to the articular cartilage. Vitamin C and vitamin E have good properties as well to keep the joint healthy. We don't specifically recommend that people take those supplements because you can get a lot of those from your diet, vitamin D from the sun. But sometimes people do have deficiencies of those vitamins that might require, taking some extra. So that's something to talk to either your primary care doctor or a rheumatologist or your orthopedic surgeon about. Lifestyle activity modification, again, just promoting healthy joints, healthy muscles, staying healthy, fit, and active. Low impact exercise is great for joint health. So things like swimming, biking, elliptical machines, walking on a treadmill, maintains the range of motion, and range of motion at joints actually helps drive nutrients into that cartilage and stay healthy. So that movement is really healthy for cartilage. And actually, even after some injuries, we make sure that people are maintaining joint motion to improve the health of their cartilage. High impact exercise can be beneficial as well. High impact exercise like running actually helps keep the bones strong, and running isn't necessarily associated with wear and tear of the cartilage as long as you have good mechanics. The time when you might want to back off high impact exercises if you are developing joint pain or degeneration. And then physical therapy or a home exercise program or a combination of both can be very helpful. So focus strengthening the core, lower extremity muscles really helps with walking mechanics, stabilizing the knee with stronger muscles with a focus on quadriceps, hips, gluteal muscles, and core muscles. Safe exercise participation is important. So cross-training and varying your activities can balance the pressure on certain joints. Doing too much of one thing can focus too much pressure. And then that also promotes active recovery. So if you go for a long run one day and then cross-train and do some swimming the next day, it allows for your body to stay active, but also recovering some of those joints. You also want to maintain rest periods, at least 1 to 2 days off per week, and avoid consecutive intense sessions, especially if they're associated with fatigue of your muscles or pain. Things like yoga, Pilates, maintaining the core and small muscles of the body are very important. Maintaining flexibility is great for reducing the joint noise. So we talked about the snapping of those different ligaments around the body, especially at the hip and knee. That can happen at the ankle too. Just maintaining flexibility with dynamic motion and dynamic stretching can really improve the mobility of those joints. Occupational, just some quick things here. In Wisconsin, we have all kinds of different jobs that require a lot of physical activity. So some different things to just be cautious of, especially if you're having joint pain to begin with. Avoiding repetitive jumps, using proper steps to go up and down, having 3 points of contact to avoid like twisting and pivoting injuries. When you're lifting, do not lift and pivot. Try to lift and then change direction in a careful manner. When you're kneeling can provide a lot of built up pressure in the knee. So avoid prolonged kneeling, or if you are doing it, change position as much as possible. You can use padding and protection, and then avoiding slips, trips, falls that can cause joint injuries. Next, we'll talk about treatment for these different joint noises. I put a picture of a ladder on here because we talk about the ladder approach to treatment. So when you're starting on that first step, it's something that's fairly simple, fairly easy to access. And then if things aren't working, then we can gradually go up that ladder. The treatment for joint noises and pops and catches and cracks can depend on the cause, the severity, the acuity. And then we generally take stepwise approaches to try to manage these problems. So for physiologic noise, we talked about that this is noise generally is not associated with pain. Oftentimes these are voluntary, popping of joints, something that you can show people that you can do, or maybe they might get annoyed with you doing. These will not often require treatment. So, especially just with painless clicking, we can just keep an eye on those. For ligament snapping, we talked about improving flexibility. Also improving mechanics of your activity can be helpful for that, whether it's on the job and changing how your workstation is set up or how you're doing things, or whether it's with sports and making sure you have good running mechanics and jumping mechanics. For pathologic joint noise that we talked about, the treatment will generally depend on a specific cause. So it comes down to figuring out the cause of the joint pain first and then assessing what we need to do from there. So sometimes this does require further imaging. The most basic that we use are x-rays, but x-rays show the bone structure and may not show the detail of the joints. So then we may need to move on to another kind of imaging. So we can use ultrasound, MRI, CT scan to get more detail of the joint when that's required. Sometimes it may even require diagnostic arthroscopy, where we use small incisions and cameras around a joint to figure out what's going on. That is less likely, but some of the causes of joint pain do not even show up on MRI. For instance, we've talked about the plica. Sometimes with the size and just how they're located, the plica doesn't show up on MRI. It might be associated with some swelling in the area. And we may go in with a diagnostic arthroscopy to make sure that that's there and then treat it when we're there. So talking about the arthroscopic surgery, this is when you make small incisions around a joint and go in with a camera. And this can be done at a lot of different joints in the body. You know, the bigger joints like the knee and the hip, and even small ones such as in the wrist or ankle. It's a versatile intervention, and it's generally minimally invasive. We can usually visualize the whole joint and cartilage surface, which can be very helpful for diagnosing these different joint noises. So different things that can be treated with arthroscopy. For instance, we can repair or debride a meniscus tear to smooth off that area and make it so that meniscus isn't moving in and out of the joint with every step. We can also remove a pathologic plica that can be smoothed. We can smooth small cartilage lesions, and we can even remove loose fragments. So like in the picture here, there's some loose cartilage pieces there that are present because of a cartilage injury. So we can use small biter or small shavers to smooth out those areas so that they're not causing the catching and locking and grinding. Instability of different joints can also be treated in a few different ways. Physical therapy is often the first step in many cases. This can be also associated with use of a brace. And then sometimes it does need repair or reconstruction to improve the stability of the joint. So there are many options for that depending on the joint. The two pictures listed here are some common ones. So the one with the incision that's the front of a knee, and that is showing some patella instability. So when that kneecap is sliding out or even popping out of place, sometimes we need to go in and reconstruct the ligament that attaches it to the bone, or even realign bones sometimes. The picture of inside the joint there is a labrum repair in a hip, but it can also be done in the shoulder. So repairing that labrum, which is the lining of the joint that provides kind of a bumper stability, that can get torn with a shoulder dislocation or hip injury, and repairing that down can improve the stability of the joint, which then in turn decreases the clunking or clicking that you're getting from that instability. Cartilage injuries can be one that is a really common cause of joint pain, and that's why we talked about it a lot today. In general, the cartilage does not heal well on its own and has a really poor blood supply and does not regenerate very well. In general, you can resorb some very small, loose bodies, and the body can form some kind of scar tissue cartilage over the cartilage injuries, but it doesn't repair itself back to normal very well. The latter type treatment we can use for that, starting with just symptomatic, ibuprofen, ice, topical treatments as a start. It may just be that your body has an inflammatory process that needs to be calmed down, and then you can actually do okay. We can use therapy and home exercise programs. And then I'll talk about the rest in here in the next slides. So injections can be used for cartilage wear or cartilage injuries. Cortisone shots can be prescribed as a local anti-inflammatory. These can be repeated, although we try to not repeat them over and over again, especially if we can affect the underlying cause of the pain and symptoms. This is symptomatic only. It won't heal the cartilage. And in fact, if we repeat those over and over again, it may in fact injure or weaken the cartilage. There's also some lubricants that can be used. So these have different brand names. Some of them are listed there, but it's a gel injection like your body's own synovial fluid. It says here a series of 3 to 5 shots, but these actually, the brands have come up with 1 shot as well, which is really nice. It can give significant pain relief. It can also provide lubrication, which might decrease some of that grinding and catching, and that can be repeated about every 6 months. Some more newer therapies that you may have heard of. One is called platelet-rich plasma. You can take the blood draw from the arm and spin that blood down into plasma with a lot of platelets in it. And platelets have growth factors that can be released into the joint then. It may help restore or maintain injured cartilage, giving some joint health. So studies have shown moderate effectiveness compared to other injections. It's definitely not a cure that you inject in and the cartilage automatically regrows, but it can be beneficial. And then one that is often asked about is stem cells. And constantly we're learning more about stem cell injections and treatments. The technology is not quite yet effective to be able to inject it and just heal the cartilage right away. But this is likely to continue to improve, and it may continue to be a treatment in the future. Currently, the stem cells don't actually grow cartilage, but they do, similar to PRP, release growth factors and can help with pain too. One drawback to these is they can be very expensive. So one thing that I caution patients with is beware to direct to consumer advertising that some companies have that may be promising things that are not able to deliver. There's all kinds of different sources: fat cells, bone marrow cells, synovial cells, and other sources. And I think as the technology improves, this might become more and more of a viable option. One way that we are able to use stem cells now that are actually grown stem cells to regrow cartilage is one way that we can actually repair cartilage. So there are certain situations where we can actually go in surgically and repair a spot of cartilage that has been damaged. And as this has gotten better over the last 20 years or so, it's been very helpful for patients who otherwise before did not have very good options for this. In general, this is in younger patients, but as time has gone on, the research has shown that even a little bit older patients, as long as they're healthy and active, can benefit from these treatments. So one is called autologous cartilage implantation. So that just means cartilage from your own body is regrown in a lab that can then be used to replace the injured cartilage. So here is a picture of some of that injured cartilage. So this often is a 2-step surgery, although there's different ways to do this in one way, in one surgery. So on the side here, there's some injured cartilage. You can see the cracking and wear and tear that almost with bone exposed to that cartilage. In general, the body's not going to be able to repair that. So instead, we can go in and surgically repair. In the middle picture, it's actually a cutout of where we take out the unhealthy cartilage in a specific shape. Usually it's an oval or a circle, or in this case, a little bit more rectangular. And then we can place the membrane of stem cells that are grown, and either with some fiber and glue that sticks right on there or a suture, we can repair that cartilage and then let the body heal. And this has been very successful. Another option for bigger areas or areas that have had some bone loss underneath too, we can use cadaver bone and cartilage to repair a damaged cartilage surface. And we could easily do a whole hour on talking about these different techniques and things that have been very interesting and very beneficial to our patients to get them back to full activity instead of having to think of more of the replacement type options. And then finally, we do have joint replacements for all kinds of different joints in the body. And this is kind of the last step if there's widespread cartilage injury that would be causing grinding, pain, popping, catching. And if there's persistent pain, persistent dysfunction, disruption of daily activities, we think about replacing the joints. So that concludes the presentation that I have. So if anyone has questions, you can send them on over to Chris and we'll kind of go through some questions. Otherwise, thank you for listening and hopefully that was helpful. Again, feel free to contact us with these numbers here in Eastern Wisconsin or Western Wisconsin or wherever you are. We can help you answer questions about the noises that are happening in your joints or with any other injuries or pain that you're having. Thanks again.
Thank you very much, Dr. Haskins. As he did mention, please, if you have any questions, you can still submit them through the chat. We did not have any that were submitted yet, but I do have a few questions I would like to ask of Dr. Haskins. As you went through the early part of your presentation, you talked about there was different types of clicks and clunks and pops and all that. Is there a difference in the meaning of a click versus a pop as you look at different age groups? Is like a senior citizen, does it affect a senior citizen differently other than like a teenage adolescent? Are there different things to look for or be concerned about when you hear or feel those things?
Yeah, I mean, that's a good question. So there are definitely different things that we're looking for in those different populations. So especially in the teenage population where a lot of athletes may find that they have those clicks and pops and they're kind of wondering what's going on and they're trying to participate in athletics or whatever they like to do. There's some of those residual embryological issues that can be going on, like the plica or the discoid meniscus. So those are things we're looking for specifically in that population. They also can have a much more imbalanced muscle groups. So a lot of athletes are growing quickly and their body needs to catch up for like muscle strength and stability. So those are things we definitely keep an eye on in that age group. And then as you get older, you have less of that and more common of the joint degeneration. There are definitely some relation to as you get older, you can have some more of that physiologic noise. Even I think we all, either if you're reaching those ages or if you have family members, you can hear their joints pop when they're getting up from a chair and things. So that physiologic joint noise becomes more prominent. And as long as it's not associated with pain or dysfunction, then we can just keep an eye on it. But if it does become painful, more of that degenerative issues is what we're looking for when people are getting older.
All right, thank you. We did have a question submitted from Sid. Can you speak to how changes in weather would cause increased knee or other joint pain? I know you hear a lot of folks say, oh, I can feel a storm coming, or I know it's coming because my knee starts to hurt. Are you able to kind of elaborate on that a little bit?
Sure. Yeah. I mean, that's a really good question. And it's funny. Some patients mention that they kind of preface it and say, you might think I'm crazy, but I can feel when that storm is coming. But it's actually a real thing. So the body and joints are very sensitive to changes in pressure. So as the barometric pressure in the atmosphere changes, you can have changes in joint achiness or even popping and snapping in joints. Although I think that's less frequent. I think it'd be more associated with joint pain. And that can be more noticeable for joints that are either degenerative and arthritic or after like a fracture. So for instance, if you break your wrist, you might always kind of notice that change in pressure coming. I'm not sure that I can fully explain that, but it's definitely a real thing.
Well, again, thank you, Dr. Haskins. And I want to thank everyone for attending this presentation this evening. We certainly hope you found it helpful and valuable. If you do have any additional questions, please feel free to reach out and call Prevea Orthopedics at those phone numbers listed there. We are absolutely able to assist you with those questions, or if you need to set up an appointment, we are happy to help with that. Again, I want to thank everyone for attending and Dr. Haskins for this wonderful presentation, and we hope you have a fantastic evening. Thank you.